Good morning, everyone. My presentation today is drug expert, and my drug is ursodeoxycholic acid. It is also called Ursodiol. So it is known as a Ursodiol. It is a secondary bile acid produced in the human and most other species from metabolism by intestine bacteria. It is an epimer of Chenodeoxycholic acid, and it is synthesized in the liver in some species. It is used to treat or prevent several diseases of liver or bile ducts, mostly for the gallstone in patients as an alternative to a surgical procedure to remove the gallstone. There is many brand name. The most used brand name is Udiliv 300 tablet. It is 300 mg. Actibile 300 mg tablet. Golbi, it is a 300 mg tablet. Sorbitol, again 300 mg tablet. And Odihip Forte, it is 300 mg tablet. Mechanism of action. Actually, the cholesterol remains dissolved in the bile with the help of bile salts. There will be a salt of cholic acid and chenodeoxycholic acid conjugated with glycine and taurine. Because bile salts are highly amphiphilic. A high cholesterol bile salt ratio favors crystallization of cholesterol in bile. These crystals cause stone formation. Chenodeoxycholic acid and ursodeoxycholic acid or Ursodiol decrease cholesterol content of bile, so enabling solubilization of cholesterol from stone surface. Administration and dosage. It is a film-coated tablet available for oral administration. The absorption of the drug is enhanced by other bile acids. Therefore, it is recommended that the drug is taken during meal with full or to facilitate biliary secretion by the gallbladder. The dose is 5 to 25 mg per kg. It is a safe dose and well tolerated. In patients with primary biliary cirrhosis, a dose of 13 to 15 mg per kg is preferred. The dose of 10 to 15 mg per kg used mostly for gallstone dissolution. Pharmacokinetic. It is absorbed from the gastrointestinal tract and undergoes first pass metabolism and enterohepatic recycling. It is partially conjugated in liver before being excreted into bile, some of which is excreted directly in the feces. The rest is absorbed and mainly conjugated and sulfated by the liver before excretion in the feces. The therapeutic use of this drug, it is indicated in the treatment of primary biliary cirrhosis and for the dissolution of a small to medium-sized cholesterol-rich gallstone in patients with functioning gallbladder. It is very interesting. Last night, I just referred to one video from the Sheffield University, and I find that there is another therapeutic use. Recently, the researchers found it is in a Parkinson disease, and it is very interesting. Actually, I will send the link if you want to refer this one because it is very vast. Researchers found that the rescue effect of ursodeoxycholic acid on the liver cells may actually be due to cellular protective mechanism rather than simply displacing the buildup of bile acid. This drug has shown that it has a marked rescue effect on the mitochondria or cell batteries in Parkinson's affected neuronal tissue. Researchers demonstrated that this drug could protect dopamine cells grown in culture from apoptosis or programmed cell death. And they also found that this drug, by regulating a specific cell survival pathway, the neuroprotective effects of ursodeoxycholic acid have also been found in a large screening study conducted by researchers at the University of Sheffield in England. So we are coming to the ADR of this drug. In gastrointestinal disorder, there is abdominal discomfort, abdominal pain, constipation, diarrhea, dyspepsia, nausea, and vomiting. General disorder, there is at administration site, there is a malaise, peripheral edema, and pyrexia. Biliary disorder, that will be jaundice also. Interaction, actually it should not be administered with charcoal, cholestyramine, cholestypol, or antacid containing aluminum hydroxide or aluminum oxide, because this preparation binds to this drug and in the intestine and thereby inhibits its absorption and efficacy. So it should be used a preparation containing one of these substances be necessary. It must be taken at least 2 hours before or after this drug. Also, deoxycholic acid can increase the absorption of cyclosporine from the intestine. In patients receiving cyclosporine treatment, blood concentration of this substance should therefore be checked by the physician, and the cyclosporine does adjusted if necessary. The dose should be adjusted if it is necessary. In isolated case, ursodeoxycholic acid can reduce the absorption of ciprofloxacin also. In pregnancy and lactation, actually there is no adequate data on the use of this drug, particularly in the first 3 semesters of pregnancy. But in animal study have provided evidence of teratogenic effect during the early phase of gestation. So it must not be used during pregnancy. It is not known whether this drug passes into breast milk or no. So therefore, ursodeoxycholic acid should not be taken during lactation. If treatment with this drug is necessary, breastfeeding must be discontinued. There is a contraindication about this drug. Ursodeoxycholic acid should not be used in patients with acute inflammation of the gallbladder or biliary tract, with occultation of the biliary tract, with frequent episodes of biliary colic, with impaired contractibility of the gallbladder, with hypersensitivity to the bile acids or any excipients of the formulation, who are pregnant or breastfeeding, or in women who may become pregnant, with chronic liver disease, peptic ulcer, or in those with inflammatory disease of the small intestine and colon. There is a monitoring also should be taken during the first 3 months of treatment. The liver function parameters like SGOT and SGBT should be monitored by the physician every 4 weeks, thereafter every 3 months. So this is about this drug. Thank you. Anyone has any question?